Down syndrome is by far the most common chromosomal disorder in humans and the most common cause of intellectual disability. There are 47 chromosomes instead of 46. It is primarily caused by trisomy chromosome 21. Now, what are the clinical presentation? When taking history from parents of a child with Down syndrome, history should include feeding history to ensure adequate caloric intake, prenatal diagnosis of Down syndrome history. If there is any delay in the cognitive abilities, ask about the delay in expressive skills. Now, what are the signs and symptoms of the Down syndrome? Have characteristics of craniofacial findings like flat occiput, flattened facial appearance, flat nasal bridge. There will be epicanthal folds, brush field spots, and protruding tongue. Dysplastic ears. There will be generous knuckle skin, short extremities, and wide space between first and second toes. This is also called sandal gap. Dry skin will be there. What are the complications of the Down syndrome? First of all, cardiovascular complications include atrioventricular septal defects. Number 2 is the Eisenmenger syndrome and pulmonary arterial hypertension. What are the respiratory complications like lung infection, aspiration, cor pulmonale? Gastrointestinal complications are dysphagia, celiac disease, chronic constipation, and obesity. Ophthalmologic complications include refractive errors, strabismus, congenital cataract in 5% patients, and glaucoma. Otolaryngologic complications include hearing loss in 40 to 75% of cases. What are the endocrine complications? These include hypothyroidism due to Hashimoto thyroiditis and type 1 diabetes mellitus. Hematologic complications include leukemias, AML and ALL. AML is more common in infants and ALL more common in children older than 1 year. Next one is the Alzheimer's disease. Now, how to diagnose a patient with Down syndrome? First of all, clinical assessment is very important. Next, we will get help from the labs. First, complete blood count with differentials, bone marrow examination to rule out leukemias, thyroid stimulating hormone and T4 to rule out hypothyroidism, and karyotyping for diagnosis of trisomy 21. Next one is interphase fluorescence in situ hybridization for rapid diagnosis of trisomy 21. Echocardiography in newborn suspected of having trisomy 21 to rule out cardiac anomalies. Now, management of the trisomy 21. There is no medical treatment for intellectual disability, but improved medical care has greatly enhanced quality of life and increased life expectancy. Special considerations include annual audiologic and ophthalmologic evaluation, vocational training, discuss issues related to transition to adulthood, timely surgical treatment for cardiac, gastrointestinal anomalies play important role in the management. Now, occurrence of the trisomy 21 is strongly dependent on maternal age. The incidence of this syndrome at various maternal ages as follows. At age 15 to 29 years, incidence is 1 case in 1500 live. At 30 to 34 years of age, incidence is 1 case in 800 live births. At 35 to 39 years of maternal age, the incidence is 1 case in 270. At 40 to 44 years of maternal age, incidence of Down syndrome is 1 case in 100 live births. And when maternal age is greater than 45 years, the incidence is 1 case in 50 live births.